Hello everyone, my name is Asra Parkar and I'm a speech language pathologist. Today we are going to talk about speech therapy fundamentals. So before we begin, I would just like to make a comment on what is communication. Communication is basically just the exchange of information, between the sender and the receiver. The exchange can be done in the form of written, symbolic, pictorial gestures, or even sign language. Now, who is a speech language pathologist? A speech language pathologist is a certified individual who can assess, diagnose, and make treatment plans for all the speech, language, and communication disorders. We are usually certified with RCI and have RCI numbers. So, if you want to refer to an audiologist or a speech language pathologist, please look for their RCI numbers. Now, as an SLPs, we work on language disorders that is receptive, expressive, or both can be affected. On speech disorders basically qualify as the speech clarity issues. We also work on voice disorders, wherein the voice is a little hoarse, breathy voice, or even when they have a female-like voice, that's called as pivophonia. We work on those things also. We work on fluency disorders, categories stuttering, cluttering, and also in feeding and swallowing. Now, the aim of speech therapy always is to rehabilitate or habilitate an individual so that they can lead a normal life. Now, especially in case of adults who have had stroke or had TBI or aphasia, our goal is to ensure that they go back to the original life. And in the case of pediatric population, our aim is to make sure they attain age-appropriate language skills. Of course, there are certain cases wherein coming back to normal or the original life, as we say, is not possible. So in those scenarios, like example, I would give us an autism or in the cases of Parkinsonism. So in those scenarios, our job is to maximize their communicative potential. Now, language has four modalities: reading, writing, listening, and speaking. So speech therapy is not just working on speech as in the speech modality. We also work in reading, writing, and listening because all these are extremely important for communication. If an individual is not able to talk, he can communicate via reading and writing also. So these are the four different modalities that a speech therapist works upon. Now coming to language. Now language disorders in pediatric and adult can be clearly distinguished. In pediatric, they are usually from birth or they are usually acquired. And examples would be delayed speech and language, autism spectrum disorders, hearing impairment, cerebral palsy, intellectual disability, childhood apraxia of speech. And in adults, they are mostly acquired either post-stroke or some trauma. So they qualify as aphasia, right hemisphere damage, or TBI. Now coming to language therapy. In pediatric population, the environment has to be very much conducive to therapy, and it has to be more of play based. So when we say about play based, it is not just random play. It is actually proper goal oriented therapy. Like basically, when we have certain goals for therapy set up, we actually even sit and plan the activities that can be done with a child. Of course, being a child, they are usually bored with the same activities. So repetitive activities using different novel activities to ensure that we have a proper result and we obtain our goal. That's the part of the language therapy here. It's actually a structural play and integral part. We use age-appropriate activities and the toys. A child with 10-year-old will not prefer to play with these kind of pegs, but a 2-year-old or a 1-year-old will prefer to play with these kind of current sorting. So the activities and the toys that are chosen are actually age-appropriate. So what all we can use is we use books, charts, storybooks, toys, real objects, figurines, clay, etc. And anything that can serve as a toy for us. Now, these are the certain samples I have kept to know how exactly speech therapy is taking place. So here you can see the first example being, of course, a tabletop activity wherein the therapist and the individual are playing with animals, of course, with animals, sorry. Then here you can see there's a child who's doing pretend play. Yes, pretend play forms a very integral part of therapy. Why? Because that's the thing when the child starts using his own skills for development. We provide stimulation, we provide the structure, but here it's the child who works on uses his own brain. Just give me a minute, please. Sorry. Here you can see the therapist and the child working on imitation. Imitation is basically just the copying of skills. Why copying is important, because any language or any skill we learn is by copying. Like if you want to learn a new language, what you will do is you'll go to, or maybe you can open an app or ask your friend to say, how do you say this certain word in French? They'll say that word and you'll copy them. So that's the copying. So that's how you learn a language. Same way, copying is extremely important. Then certain times there are group sessions which are required, wherein even social skills are targeted for the child. Pretend play, social skills. Here you can see the therapist using certain clays and their molds for having communication and the goals. Here you can see, yes, you might see it's just a play, but no, this is movement-based play. There are a lot of kids who have attention deficit disorders, and in those scenarios, kids and hyperactivity, kids prefer movement. They don't prefer to sit down and do an activity, but they will learn better when there's movement. So depending on the child's pros and cons, we choose activities that actually will facilitate the child's learning. Now, in cases of intellectual disability, of course, we work on child with intellectual disability, but how? We help in developing near normal speech and communication skills. Because in those kids we know, or rather, attaining adequate amount of skills is more important than development of normal speech skills. So we use a lot of compensatory approaches and strategies to minimize the communicative issues that they have and attain a new normal speech. In cases of cerebral palsy, you can see these are the example of a child with cerebral palsy who has a lot of drooling. So even we work on drooling, then they have open mouth posture because of their anatomical features. They might have like teeth protruding, or they might have this open mouth, which can lead to drooling, a lot of saliva coming out. So all these things have to be taken care with the perspective of hygiene, health, and everything. So we work on the oromotor skills of the child. Here you can see a therapist doing a sample of the oromotor massage. Of course, it's a picture, but you can see how the therapist is working on. So we work on strengthening of oromotor structures, we work on drooling, and we even work on language, because certain times the kids with CP also lack language. So language is also worked upon. And here the language is worked upon, and similarly in play-based. Now, there are a lot of times when kids learn language, but the output is restricted given their anatomical features and how they're built. Sometimes verbal communication is not possible. So in that case, we proceed with non-verbal communication. In hearing impaired individuals, auditory verbal therapy. Of course, when the individual is not hearing, he can definitely communicate via gestures. But when the child starts using a hearing aid or a cochlear implant here, as you can see, in that scenario, auditory verbal therapy is recommended, wherein the child is trained to listen to speech and speak also. Now coming to adult language therapy. So adult language therapy is recommended in cases of aphasia, traumatic brain injury, or when the language is affected. So in adults, the difference is it is more structured, and methods are employed depending on the type of aphasia. Of course, language is also taken into consideration. Whatever the first language of the individual or the comfortable language is preferred. We prefer use of real objects as compared to your use of toys. Sometimes, a lot of times, music and rhythm helps. So in cases of aphasia, a lot of times it's not just the singing of songs, but rather using music to retrieve the language helps. So we have this term called as melodic intonation therapy, which uses music and rhyme to retrieve the language skills. At times, in more severe cases, like in the global aphasia, we might have to stick to drawing, singing, or signing, or use some nonverbal methods for communication. But in all cases, the end goal of a speech therapy is to ensure that the individual can communicate.